17, verse 11 to 19. Jesus met 10 lepers, and on their way they asked to be healed. And when they were told to go and seek clearance from the scribes and the Pharisees, one of them, or all of them, observed that they had been healed. One of them returned back to the master to give thanks. This day, as a nation, we've come back to give thanks to the Lord. The Lord has been gracious, and favor has been bestowed on Uganda as we come back to give thanks for being healed of the scourge of Ebola. So we are here to thank God for giving us this divine favor of healing. Let us pray. Almighty God, in whom we move and have our being, we thank you for this beautiful nation, Uganda. We thank you that our future is in your hands. Lord, when we were challenged, when the Ebola outbreak happened in this part of the world, Lord, we are seeking your divine intervention. Thank you for giving us the leadership, through giving us wisdom, giving the leadership knowledge in how to handle this. We also want to thank you, Lord, for the president of this republic, Yoweri Kaguta Museveni. We want to thank you, Lord, for the ministry led by General Acheng and all the partners. We want to thank you for the people who bestowed their resources and expertise in helping us handle this Ebola outbreak. Lord, we ask you that as we convene, we invite your presence that be part of this celebration, and everything that we are going to do here will be blessed by you. We thank you for the people of Mubende and Kasande especially, who suffered most with this outbreak. Lord, we pray that it's time now for restoration. We want you to give us the ability to embrace the restoration as we celebrate. We thank you for those who have traveled. We thank you for journey mercies. Lord, as even we depart from this place, going back to the different parts, we ask you that you'll give us the same journey mercies as we depart. For those who are still on the way, Lord, we pray. In Jesus' mighty name we've believed and prayed. We all say amen.
Thank you, Dr. Daniel Chabayinze, for such a brief and interesting prayer. Honorable Minister of Health, Honorable Dr. Jane Ruth Acheng, who is also the woman MP for Lila City, the Minister of State for General Duties, Honorable Anifa Kawoya, the ambassadors present, heads of UN institutions here, members of parliament present, the district leadership, all members of the district task force present. We have other colleagues of ours who have joined us from other districts, from Masaka, from Jinja, from Kasanda, and many more other areas, including Bunyangabu. We have senior colleagues from Ministry of Health, specifically heads of departments, directors, the Director General, and from the technical side, all these have been headed by the Permanent Secretary, Minister of Health, Dr. Diana Twine. We have our colleagues from national referral hospitals and regional referral hospitals. All key personalities will be introduced in their capacities. Before we start, Honorable Minister, allow me to invite the LC1 chairperson of this place. And Honorable Minister, allow me to let you know that we have made adjustments in the program. This function will take maximum 2.5 hours, given the nature of the visitors we have. By latest by 2 p.m., we should be through with the function. And I request all those who are going to be invited to come here and give remarks to use the time provided. Chairperson LC1, kindly use 2 minutes to welcome us to your area. Thank you.
Thank you, our MC. In particular, I want to thank Doctor for the good prayer you have given us today. Honorable Minister, our guest of honor, directors, commissioners and assistant commissioners, our partners, all the RDCs around, honorable MPs, district chairpersons who are around, district task force members, senior civil servants, health workers, and survivors of Ebola. Madam Minister, I'm told to talk within 1 minute or two, but I would like to thank you very much, you in particular, and our president, for making sure that Ugandans survive the outbreaks of all diseases which come around. Next, I would like to thank the World Health Organization. Actually, it has done good for us, for the citizens of Mubende, Kasanda, and other neighboring districts, for the good work they put in Mubende. We are really very appreciative for that. And thank you very much. However, because I'm told I will not thank everybody, all of us survivors and people of Mubende, Kasanda, and neighboring districts, we have been working together. More so, the people of Mubende in particular, because Kasanda is a son of Mubende, Chivoga and Chankwanzi. So I would like to thank you very much for the tolerance, for the patience that you have been carrying around. However, Madam Guest of Honor, this one I think it will go to RDC because they have been leading these teams. I just hear, even today this morning I was hearing people in Kasanda. There are some workers, health workers, have not been paid. They are demanding what? They are demanding the appointments. I don't know which comes first. You first work, they give you the appointment, or you first make the appointment. So, Madam Aradis, I think you will elaborate about that. Lastly, Honorable Minister, because this is our country, this is Uganda, we are in the same world, outbreaks will be coming all the time. There are some people who work like barbarians. You find a border carrying a pregnant woman, moreover on the main. Then an officer, a security personnel, comes and helps that person. People have died because of not Ebola, because of not COVID, but because of the security people harassing people. Please, next time when we get such incidences, that person who is being carried by that border, that particular person at that particular time, that is the ambulance of that person. Please, next time when we get such problem, save us, save life, save Ugandan. Thank you very much.
Chairperson Elasuan, thank you for the remarks. I think your Secretary for Health didn't give you updates as per some of the asks you have made, but I think you'll be able to get more information before we leave this function. Honorable Minister, we are in a municipality. We have come here to officially receive the good news. My assumption is that there is no lamentation. We know all of the key challenges and the successes we have achieved during this time. Let me use this opportunity to briefly ask the mayor to come and use 2 minutes to welcome us to Mubende municipality. And the mayor is going to use that time on behalf of the entire district leadership to welcome us in the district and officially welcome the minister and her visitors in the district.
Thank you very much. The Minister of Health and your team, allow me to say all protocol respected. On behalf of Mubende District and Mubende Municipality, we welcome you with your team to this historical function where we are celebrating victory over this epidemic which had attacked us, and Mubende was an epicenter. We thank you, we thank the government of Uganda and thank all the partners who participated in the struggle to make sure that we defeat this disease, Ebola. We are very happy with the coordination and advices which have been given from time to time, more so to our RDCs in Mubende, RDC Mubende, the way she coordinated the task was so marvelous. We are very grateful. We thank the councillors, we thank the leaders, we thank the VHTs who really did commendable job. At times they could go through a lot of difficulties, but they remained focused on fighting this Ebola epidemic. One time I heard that Uganda is good at handling such emergencies, but I came to prove that, Mama Minister, you have made a beautiful foundation for such attacks. Whenever they will be arising, you have the capacity to deal with them. We promise that much as you are declaring today that Ebola is gone, but we are going to remain on lookout to make sure that we don't go back where we have come from. Wish you nice stay in Mubende District and Mubende Municipality. Thank you very much.
Honorable Minister, after we have been welcomed in the district and in the municipality, I would like to take this opportunity to invite the Director General to come and introduce to you the different dignitaries that we have. There is quite a number of key leaders that we have from government, from UN institutions, from USAID, and a number of ambassadors here, and a number of visitors from other districts. Dr. Charles Olalo, kindly come and recognize the key delegates that are here.
The Honorable Minister of Health, who is the guest of honor, the Honorable Minister of State, in charge of general duties, Honorable Hanifa Kawaya, Your Excellencies, the ambassadors, all implementing partners, district leaders, all our workers, the media, all protocol, respected ladies and gentlemen. My duty this morning is to introduce the members who accompany the Honorable Minister, the delegates of His Excellencies, the ambassadors and High Commissioners. And after that, I will request the person who is co-aims Master of Ceremonies with the in charge of health education in Mubende to introduce the district leaders. The Honorable Minister is accompanied by ambassadors from the U.S. Ambassador, Her Excellency Natalia Brown, the Embassy of Ireland, represented by His Excellency Kevin Colgan, Royal Embassy of Norway, Embassy Ellen Otsbo Johnson, represented. The British High Commissioner, Her Excellency Kate, is represented. The U.S. USAID Director, Mr. Richard Nelson, the Mission Director. The U.S. CDC Director, Dr. Lisa Nelson. The delegation of the European Union, represented by Jan Sadek, Ambassador. The UN agencies, I will go to Ms. Susan Ngogi Namondo, is the UN Resident Coordinator. Mr. Sanis Savage, representing, the IOM Chief of Mission. Ms. Els Atafi, the UNDP representative. Mary Achieno, I don't know if she's around. Matthew Crystal, UNHCR. UNICEF, Mr. Munir Salfin is represented. The UN Women, the World Food Program. Quickly allow me to go through the implementing partners. The Chief of Party of FHI 360 degrees, Dr. Nathan Tumesije. The African CDC, the acting director is with us. Mr. Hamad Ogwel Ouma. Uganda Refugee NGO Forum, Mr. Nick Bose. Moses Isova, also from the Refugee NGO. From AFNET, we have representative from AFNET, from JMedic, from the East African Community, Dr. Eric Jesmana, is he around? Yes, she's represented. We have Miss Rebecca from USAID, and then many others. On the side of the Minister of Health, allow me to introduce the Permanent Secretary, Minister of Health, Honorable Diana Atwine. My colleagues, the directors, Director of Governance and Regulation, Dr. Joseph Okware, Dr. Daniel Chavaizi, the Director of Public Health, all commissioners, Commissioner of Health Promotion, Dr. Kabanda, who is the MC, Dr. J.B. Wanyai, who is the Commissioner of Ambulances. Let them be upstanding. People need to see them. Dr. Openso, who is the Director of Community Health, is already actually in the community. Dr. Jessica Insungwa, the Commissioner in charge of Reproductive Health. I think those are the ones I have seen. The Undersecretary, ladies and gentlemen, I was making a mistake, because definitely very important. The Undersecretary, Minister of Health. So I think I will stop here. Other delegates will be recognized. So let me ask Dr. the representative from the district to come and introduce the members of the different districts and the members who are here.
Honorable Minister, there are heads of departments here that the DG has forgotten, and one of them is the one in charge of planning and financing, Dr. Sala Vyachika. There is also Dr. Alan Muluta, in charge of public health emergencies, surveillance. There is Sister Chandi Abaku, the commissioner in charge of nursing. There is Dr. Herbert Nabasa, the commissioner in charge of environmental health. I have also seen Engineer Jojo Tim, the commissioner in charge of health infrastructure. Others that I have not seen, there's also a commissioner in charge of human resource management, Mrs. Annette Musinguzi. There is also a commissioner in charge of non-communicable diseases, Dr. Oyo. We also have a number of assistant commissioners and other senior officials from the ministry. We welcome them, and literally many of them actually head the different pillars, which I think that it is one of the areas that we speak about. Mu ngeri enjawulo tulina abakulembeze okuva mu disitulikiti eno ey'e Mubende, nga mu bano mulimu RDC. Minister, the RDC who has been the chair of the task force in the Mubende district is here with us. She has come with the deputy RDC. We do have the mayor of Mubende municipality who has given remarks on behalf of the district. We do have the DPC. We also have the DISO. We have the chief administrative officer. We have our colleagues from the regional referral hospital, headed by the director of the regional referral hospital, Dr. Batiwe, and the entire team. We have a number of chairpersons from different sub-counties that make Mubende district, and other colleagues from the divisions that make Mubende municipality. We also have different sub-county chiefs, a number of religious leaders and cultural leaders. In a special way, we also have a number of district councillors here present. I know the RDC will make some remarks and should be able to give a brief on the number of key personalities. In a special way, Honorable Minister, we have a team of survivors. There are many, they are here, and they will be introduced later at an appropriate time. Honorable Minister, let me take this opportunity to invite you to come and make the end of Ebola brief response report and end of outbreak declaration statement on behalf of the government of Uganda.
Thank you very much, MC. My sister, the Honorable Minister of State for General Duties, Honorable Anifa Kawoya, Excellencies, heads of institutions, development and implementing partners in your various capacities, the Permanent Secretary, Ministry of Health, Ministry of Health officials, the RDC of Mubende and Kasanda, LC5 chairpersons, His Worship the Mayor, political leaders of Mubende and Kasanda, technical officers, health workers, the people of Mubende and Kasanda, and the media. Good afternoon to you all. It is still morning. Good morning to you all. Allow me first of all to recognize a few people who were not introduced. I will start with the Minister of State for Health General Duties. Just stand up for recognition. I bring apologies from the Minister of Kampala, Honorable Minsa Kabanda. Allow me to recognize Dr. Jonas Tegeny, the WHO country representative. Allow me to recognize my brother all the way from Ethiopia, Dr. Uma, the African CDC director. I trust all the others were recognized. Good. So I will now go straight to my statement. Today, 11th January 2023, marks 113 days since the start of the Ebola outbreak in Uganda, which was declared on the morning of the 20th September 2022. The outbreak started in Madudu sub-county, Mubende district, and at the time of confirmation, several people had been infected and others with symptoms consistent with Ebola had died. The outbreak was identified after an adult male who later died was managed at Mubende Regional Referral Hospital and confirmed to have been infected with Sudan Ebola virus disease. Prior to this outbreak, Uganda had registered 7 previous outbreaks, as outlined below. In 2018, Ebola Zaire cases were imported from the DRC into Kasese district, with 4 cases and 4 deaths registered. Case fatality 100%. In 2012, 2 Sudan Ebola outbreaks occurred. In Chivale district, the outbreak happened in July with 11 cases and 4 deaths. Case fatality rate 36%, while the Luero district outbreak happened in November with 6 cases and 3 deaths. Case fatality rate 50%. In 2011, Sudan Ebola outbreak occurred in Luero district. This was a 1 case and 1 death outbreak with no secondary transmission. Case fatality rate 100%. In 2007, an outbreak occurred in Bundibujo district, and that was named Bundibujo Ebola outbreak, where 131 cases and 42 deaths occurred. Case fatality rate 32%. In the year 2000, Uganda's first Ebola outbreak, Sudan Ebola outbreak, occurred in Gulu district, where 425 cases and 224 deaths were recorded. Case fatality rate 53%. The Gulu outbreak was and remains the largest outbreak ever registered in Uganda, which lasted for close to 6 months. This outbreak marks the 7th Ebola outbreak in the country and the 5th attributed to Sudan Ebola virus, which was last reported in 2012, more than a decade ago, in the then Chivale district, but present-day Kakumiro district. I'll give a brief outbreak description. In this outbreak, a total of 143 confirmed cases of Ebola, with 22 probable cases and 55 deaths have been reported, with a case fatality rate of 39%. 87 recoveries have been registered in this outbreak. Of the 143 confirmed cases, 85, that is 59%, were males, while 58, which is 41%, were females. By age, 26, which is 18%, were children, while 117, which is 82%, were adults. The outbreak started in Mubende district and was confirmed on the 19th of September 2022. It then spread to Kasanda, Chegegwa, Kagadi, Bunyangabo, Wakiso, Jinja, Masaka, and Kampala City. Outside the epicenter district, which is Mubende, secondary transmission took place in Kasanda, Wakiso, Kampala, Chegegwa, and Jinja. Despite imported cases in Masaka, Bunyangabo, and Kagadi, there were no secondary transmission. There was sustained transmission in both Kasanda and Mubende districts, making the two epicenter districts. The most affected district was Mubende, which is also the initial epicenter district of this outbreak, with 64 confirmed cases and 29 deaths, followed by Kasanda district with 49 confirmed cases and 21 deaths. The records in the other districts are as follows. Kampala City registered 18 cases and 2 deaths. Chegegwa district registered 4 cases and 1 death. Wakiso district registered 3 cases and 0 deaths. Jinja district registered 2 cases and 1 death. Kagadi district registered 1 case and 1 death. Masaka district registered 1 case and 1 death. Bunyangabo district registered 1 case and no death. The major drivers of transmission were household infection and amplification in some private health facilities, except for one super spreader event in Kasanda district, which was post-burial. Burials or burial practices were not a major driver of the transmission. 3 portals of transmission were observed in this outbreak that include contact transmission, sexual, and transplacental transmission. Source of the virus. The source of this outbreak, like many others, is still not known. My ministry, working with local and international partners, continue to look for the most possible and proximal source of the current outbreak and the reasons for the occurrence of Ebola outbreaks around the months of July to October. When this research is concluded, we shall inform you accordingly. Interventions that were implemented to contain the outbreak. The government of Uganda, through the Ministry of Health and partners, implemented several interventions which led to controlling the Ebola outbreak, a success we are celebrating today. These interventions include the following. 1, setting up an on-site Ebola testing mobile laboratory in Mubende district, where samples were picked, tested, and results released within 6 hours. 2, we constructed 353 bed capacity treatment units in Mubende, at Madudu Sub-County, Kasanda District, Mulago Hospital, and at Entebbe, and equipped them with medical supplies and drugs. Number 3, we trained over 2,339 health workers of different categories from both public and private facilities. The healthcare workers were particularly trained in infection prevention and control against the deadly Ebola Sudan virus infection, psychosocial support, and care for both patients and affected families, and enhanced clinical care for the Ebola positive patients. Number 4, we enhanced the surveillance system in all affected districts, listing and contact tracing for 21 days, daily follow-up of all contacts, and active case search in the affected districts. Number 5, we carried out Ebola virus disease mortality surveillance, testing of all dead bodies for Ebola in Kasanda, Mubende, Masaka, Jinja, and Kampala City. This was aimed at ensuring no unknown transmission chains were missed. Number 6, we intensified awareness about Ebola virus disease through public addresses by His Excellency the President, the ministers, together with members of the Strategic and Scientific Committee. Daily talk shows and messages were run by local radio stations. We had social media messages, door-to-door sensitization of the communities, and sensitization of small community gatherings by the district and community task forces. Number 7, restriction of movements in and out of the 2 districts of Mubende and Kasanda, and an all-night curfew to control the spread of the virus to other districts. Number 8, quarantine of contacts for 21 days to avoid spread to other districts and to others. This was especially useful in the urban areas of Kampala metropolitan area and for resistant communities in Mubende district. I am glad to note that these measures have worked and we have successfully controlled the Ebola outbreak in Uganda. Moving forward, the Ministry of Health will continue to monitor the Ebola survivors and support them to reintegrate within their communities. I urge the population to remain vigilant and implement the standard operating procedures and report any person in the community that presents with Ebola-like symptoms. And these include sudden onset of fever, headache, weakness, joint pains, vomiting, bloody diarrhea or urine, bleeding from the body openings, to the nearest health facility or call the Ministry of Health toll-free numbers. Acknowledgements. I want to thank His Excellency the President of Uganda for his personal dedication and commitment to control efforts and the timely interventions at all levels of the response. The Right Honorable Prime Minister and members of Cabinet for all the support provided in responding to the Ebola outbreak. I also want to thank the members of Parliament who were present with us in this race, especially the woman MP of Mubende, Honorable Nakazibwe Hope Grania, who is also here in person. Honorable, kindly stand up. I thank the local leadership in all the 9 districts, including the area MPs, RDCs, LC5, council executives, and the other lower level councils. I request that you stand up, and we appreciate you. My sincere gratitude to all the healthcare workers for their selfless and tireless efforts, dedication, and commitment to save lives and end the Ebola outbreak. If there are any health workers here, please kindly stand up for appreciation. A special and very warm appreciation to all our development partners, both local and international, who have played a pivotal role, both technically and financially, in this fight to control Ebola, among other epidemics, and ensure the safety of Ugandans. Our development partners and implementing partners and all the ambassadors, please kindly stand up, and we appreciate you. And thank you for coming in person. If I wasn't here, I would have done the ULA lessons for you. Even then, I'll do it after when I leave this place. Last but not least, I want to thank my Ministry of Health teams, led by the Permanent Secretary, and I request all of you to stand up for recognition. I said last but not least, but allow me to take this opportunity to introduce the incident commander of the response. Lieutenant Colonel Dr. Chobe, please step forward. That gentleman, I said step forward. That gentleman took us through the COVID-19 response, monkeypox, Ebola, and is still running strong. Thank you very much, Incident Commander. May I request the pillar heads to join you there? The pillar heads. Pillar heads, can you please join your commander? step ahead so I can start with them. Mr. Tek Kajirita, Incident Commander Mubende. He also doubles as the Deputy Incident Commander nationally. Kajirita, I know you are the most happy person today. Well done. Next to him is the Incident Commander of Kasanda, a very difficult place, Dr. Bwire. Well done, Dr. Bwire. You can now resume your positions as I introduce the pillar heads. I will start with the pillar head of case management. We commonly call him Dr. Moha Muhammad. You step forward. That man was responsible for ensuring that everybody who went into the Ebola treatment unit came out well. Next, we have risk communication. Risk communication, Dr. Kabanda Richard, the one who was responsible for ensuring that we penetrated all the villages and spread information to the population. Next to Richard is one of my favorite sons, the one who was responsible for ensuring that we carried out quarantine in the right way. I'm sure people know him very well. He's another Richard, but he's Mugahi. Then we have community engagement, Dr. Dugum Upentho. That one lives among the community members. We have Dr. Hafsa Lukwata, psychosocial counseling. Next to the IC is the the pillar head for schools. Pillar head for schools, now I'm a little bit forgetting your name. Dr. Patrick Ajuna, the one who ensured that children went home, they were well looked after, those who were outside came back in. Then we have Herbert responsible for WASH in the communities and also in the facilities. We have Annette, human resources. Thank you for ensuring that you have a good inventory. Isaac, laboratory. All the tests. Another of my sons, Ronnie, who had two roles, supporting case management and IPC, but also human resources. Another of my favorite brothers, Alan Muruta, epidemiology. He ensured we had all the over 200 epidemiologists. Your name has escaped me. Dr. Kabweru. Dr. Kabweru, I didn't expect you here, but I'm excited to see you. Dr. Kabweru, responsible for treatment, clinical sub-pillar. The woman who guided us on money, I should call her a lady, who worked very closely with the permanent secretary to guide us, Dr. Sarah Vyachika. Thank you very much. Another lady who loves children and women and worked very closely with schools and case management, Dr. Jessica Nsungwa. Have I missed anyone? The ones I have missed here, please help me. Oh, district pillar leads. Give me your names. Mr. Chimera, lab pillar head Mubende. And Kasumba, surveillance pillar head Mubende. Thank you very much. I'll now request you to take your seats, but you can walk with a swagger. Before I come to the most important people, allow me again to introduce, you know them of course, the permanent secretary, and thank her for timely release of funds to the districts. PS, stand up once again. Thank you very much for ensuring that we had resources at every point where we had interventions, and the Director General in absentia. Now, I want to introduce the most important people, the ones who ended the epidemic. We call them our most important stakeholders in this response. And before I request you to stand up, I want to thank you for your sacrifice, your patience, and your commitment to end the outbreak. Money alone cannot end it. Health workers cannot end it. The structures we have in place cannot end it. So the most important people in this response are the communities, the population of Mubende and Kasanda. Stand up and we appreciate you. Please stand up and we appreciate you. You are fearing appreciation or you are overwhelmed? Thank you very much. Indeed, you ought to know that if it wasn't for you, this outbreak would not have come to an end. You did a good job moving door to door, and in that regard, allow me to appreciate the backbone of the communities, the village health teams. Are they here? Village health teams? Thank you very much. You are part of the communities. I will now move to the declaration. Having spent 2 incubation cycles of 21 days each, making a total of 42 days, yesterday, the 10th of January 2023, since the discharge of the last confirmed case on the 30th November 2022, having registered no new Ebola case, despite sustained intense surveillance, both at the epicenter districts and nationally. I now confirm that all transmission chains have been fully interrupted, and take this opportunity to declare that the outbreak is over and Uganda is now free of active Ebola transmission. For God and my country. God is good.
Espling on the track.
All the time. And we give him the glory. Thank you, thank you, thank you. God bless you all.
Honorable Minister, I was wondering, some of us who are not your sons and your brothers, where do we fall? It seems Alani Muluta is the only sweet brother. We fall under other categories. Thank you, Honorable Minister, for the good news. I think we need to have some time off to dance off the stress since 2020 and the hard work as we prepare for next week to start on the fight for malaria. Next on the agenda, we are going to receive end of Ebola outbreak declarations by the international community. And I would like to invite, but before I invite, Honorable Minister, we have the Director for Public Health and Environment from KCCA, Dr. Daniel Okello. I had planned initially to introduce Dr. Henry Chove before the minister did in a special way. But since he came dressed in a uniform, I thought that introduction had been promoted to the minister. We also have Dr. Issa Makumbi from EOC. Usually most of the alerts go through EOC before the technical teams get on the operational issues. In a special way, Honorable Minister, allow me to introduce Aineviona Emmanuel. I know he's very known to the media people, but without him, there is no way how we can work so closely with the media. And the media has done really a very good job. Honorable Minister, allow me to invite the country representative for WHO. Dr. Jonas has been a lucky WR because Uganda, ever since he came, we have been through epidemics, one epidemic to another. The experience you have gained from Uganda, Dr. Jonas, there's no any WR who has gained it. In a single country, you must be a special person. WR, allow me to invite you, come and take us through the next session of the declaration from the international community.
Honorable Minister of Health, Honorable Minister of State, General Duties, Ministry of Health, Permanent Secretary, Director General in your absence and in your representation, Your Excellency, Ambassadors, the UN Resident Coordinator, and other head of agencies, the Africa CDC Acting Director, my real brother, Dr. Ahmed Ogwell Oma, Ministry of Health officials, other ministries, department and authority officials, honorable members of parliament, district officials, RDCs, the Lord Mayor, religious leaders, political leaders, the people of Mubende and Kasanda, survivors, and colleagues on the ground who made this possible. This is a special day, and thank you, media colleagues, for being here to cover it. Allow me, Honorable Minister, to take this duty of confirming that the Ebola outbreak is over in Uganda. As a global health organization, both our Director General, Dr. Tedros Adhanom Ghebreyesus, and our regional director, Dr. Chidi Moete, have sent a message because they were not able to be present with you, but they have recorded messages which, with your permission, I will ask the media, the people to transmit on the screens. Colleagues, please. The Director General.
Excellency, Your Excellency, the Honorable Minister of Health of Uganda, Dr. Jane Chero, Excellencies, ambassadors, representatives of partner and community organizations, donor agencies, colleagues from WHO, distinguished guests, ladies and gentlemen, a very happy new year to you all. It gives me great pleasure to join you today on this landmark event for people's health. Though regrettably I couldn't be in Mubende district physically, rest assured of my full support. Today, we join the government of Uganda to declare the end of the Sudan Ebola virus outbreak in the country, less than 4 months after the first case was in the central district of Mubende on the 20th of September 2022. In line with the recommendations, the country has having passed 2 days since the last case paved the way for the declaration of the outbreak end. After the announcement of the Ebola outbreak on September 2022, the Ministry of Health, with support from WHO and partners, initiated a fully response plan to contain the disease rapidly. Your Excellency, I wish to commend the role of the President, His Excellency General Sept. His efforts highlight critical importance of high-level political engagement in epidemic emergency and response. I equally thank you and your team and other sectors of government for your remarkable leadership and action in responding to complex outbreaks. With no vaccines and therapeutics, this was a challenge for our outbreak in the current context, but Uganda stayed on course and continues fine-tuning its response. As the world's leading public agency and working across country, regional, and local levels, we provided technical and operational support. We deployed leaders for successful response. With the help of listeners, we devoted $6.5 million of the WHO contingency fund for emergencies for the response in Uganda and another $3 million support readiness in 66 neighboring countries. We were closely with the CDC and Ministries of Health from highest neighboring countries to establish a regional Ebola task force that coordinated readiness efforts and facilitated information sharing across the countries. Soon after Uganda declared Sudan Ebola outbreak, we worked with vaccine developers, donors, and the Ugandan health authorities to identify therapeutics and vaccines for inclusion trials. Three can vaccine providers, and the first to arrive in the country on the 8th of December 2022, constitutes a historic milestone in global capacity to respond to outbreaks and pandemics. Our team designed protocols and trained 200 members, local research teams on conduct trials according to strict standards. My sincere appreciation goes to the health staff who saved the lives of 7 survivors by offering supportive care. I express my sincere condolences to the families who lost loved ones to this outbreak and the 7 health workers who died in the line of duty. As the outbreak ended, it's essential that we review the response and lessons we learned for future outbreaks. The key role that communities play was amply demonstrated in this response and its initial challenges. We also saw the need to engage the entire health system, including the private sector. We're working with the Ministry of Health to plan an after-action review in this regard. One of the key features of this response was a collaboration with various institutions and mobilizing capacities across the board. Over the next 6 months, we'll be harnessing these lessons to inform our focus on health promotion and disease prevention. Close follow-up of survivors to ensure they are well integrated back into society will remain a priority. Honorable Minister, partners and colleagues, congratulations once again on this great achievement. Thank you. Your Excellency,
Your Excellency, Minister Jane Acheng, my sister, Excellencies, dear colleagues and friends, New Year's greetings and best wishes from all of us at WHO. I congratulate the government, health workers, and the people of Uganda for your leadership and dedication, which have enabled this Ebola outbreak to be contained in less than 4 months. I commend the government of Uganda for declaring the outbreak immediately after it was confirmed and notifying WHO as required under the international health regulations. We thank donors and partners for swiftly mobilizing resources and vaccine developers for making candidate vaccines available in record time. Even in the absence of approved vaccines or therapeutics for this species of Ebola, Uganda was able to use proven public health tools to contain the outbreak. Congratulations. I salute the dedicated health workers, partners, and communities who work day and night to save lives. This outbreak has finished, but WHO's commitment to Uganda has not. We remain committed to strengthening Uganda's health system as part of its journey towards universal health coverage and a healthier, safer, fairer future for all the people of Uganda. I thank you.
Honorable Minister and distinguished guests, you might be surprised why the world was concerned when we hear Ebola. We have the memories of West Africa and DRC, where people died in thousands, where economies were devastated. That's why we thought we should give it the highest priority to address Ebola in Uganda. And to our surprise, to our gratification, Uganda has proved it again. Even the most dangerous virus can be contained because of the dedicated health workers, the committed community, a transparent leadership which was able to support this response. The global community is learning a lot from this success. This success is not only of Uganda, it's a global success, and the global health community will learn and follow Uganda so that Ebola is not as scary, Ebola is not as devastating as we used to know it. I congratulate you all here for this great day, and Honorable Minister, thank you.
Thank you, Dr. Jonas. I thought, Dr. Jonas, that you're carrying over the day up to your neighbor. It is still within that. And since the minister and Dr. Jonas, no one used this umbrella, I think I should go with it.
You can.
Nobody should use this umbrella.
Yes, except you.
Dr. Kavanda, you challenged me again, and thank you. My apologies for misunderstanding your instruction and guidance. It gives me a great pleasure to introduce my dear brother, Dr. Ahmed Omar, who is the acting director of Africa CDC. As you know, Africa CDC is one of the great innovations where Africa is taking in ensuring that we are self-sufficient, that we ensure we take care of our health, led by people who understand our priority, our concern, and our strength to ensure that we also build a sustainable system so that we do not always rely, as we have seen in the time of COVID, on others. Dr. Ahmed, you have a great task to build that responsibility. And it is my honor to ask you, on behalf of Africa CDC, to also join in declaring this outbreak is over. Thank you.
Thank you very much, my brother Jonas. Allow me to stand on the protocol that has already been established. And as I do that, Honorable Minister, I would like to say in Swahili, pongezi and pole. Pongezi is a Swahili word for congratulations, because it is a huge achievement to be able to bring Ebola under control in under 70 days. We are counting over 100, but the 100 includes the countdown. If you look at when the first case was diagnosed to when the last case was documented, it is about 69 days. So pongezi, Honorable Minister, to you and your team. And I add pole being feeling sorry. I feel sorry for you because you have raised the bar so high. It means that the next time anything is happening in Uganda and Africa, we'll be expecting similar results under 70 days control and just over 100 days to declare any outbreak to be over. It's a big achievement, and we need to be proud of this. Let me also commend the ownership with which the government and the people of Uganda have taken this outbreak response in the last 113 days. It is the example that we on the continent of Africa need to follow when we are faced with similar challenges, particularly health outbreaks. Indeed, it is the example that we, as Africa CDC, are going to be using as we support other African countries in preparing and responding to various health emergencies and outbreaks here on the continent. Let me thank the teams that have been working in the background. The Africa CDC team, who have been here with the government from the beginning, our partners, including WHO, who have also been here from the very beginning, every other individual and organization that have contributed to this excellent response and outcome, I acknowledge and I thank you, and in a very special way, I would like to thank our health workers. Just as we wake up every day and go to our workplaces to face our duties, they go to the workplaces to face many different conditions, including Ebola. And they never stay away, even at the height of the outbreak. So for the health workers, a very special thank you, and to those who lost their lives in the process of conducting their duties, our prayers are with them and their families. Your Excellencies, ladies and gentlemen, there are some innovations that we need to carry along out of the experience, not just of this particular Ebola outbreak, but also COVID and other outbreaks that we see on the continent and beyond. One such innovation was an urgent regional approach working with WHO and hosted by the government of Uganda. Honorable Minister, thank you very much. We brought together ministers of health from the continent here to Uganda to discuss how we can be able to have a regional approach to responding to this particular Ebola outbreak. A task force was formed to address Ebola control on the continent, and that task force continues with its work even beyond the declaration today, because we need that experience in other outbreaks. We need that experience in other aspects of our work, not just as Africa CDC, but as a continent. Beyond that emergency ministerial meeting, we have also been impressed by the difficult decisions that the government of Uganda has taken, and the minister has shared some of those, including selective lockdowns, quarantine, and other public measures that have contributed to the rapid control of this particular outbreak. A very big thank you to all the village health teams, and we appreciate the sacrifice that they make at the community level, and we commit that we shall continue to use this important innovation in bringing good information to the communities so that we can be able to engage directly with those who are going to help with bringing the outbreak under control. The fact of the matter is, outbreaks begin and end at the community level. When communities are well informed, outbreaks are rapidly controlled. When communities are not well informed, then we have challenges of long and drawn out outbreaks. So a very big congratulations to all the communities where this outbreak started and ended in a rapid way. The lessons that we have learned, Honorable Minister, during this particular outbreak, indeed the lessons that we've learned during other outbreaks on the continent, give us the confidence that Africa is able to do what is required on its own, even though we welcome partners to support the work that we do. And what has happened here in Uganda, Honorable Minister, we salute the openness and the transparency with which this outbreak has been guided. We salute the openness and transparency with which information has been provided, and we salute the openness and transparency with which your government has engaged with partners who are willing to help in controlling this outbreak. Excellencies, ladies and gentlemen, disease outbreaks and threats cause a lot of social and economic stresses. We have seen it during COVID. We have seen it during this particular Ebola outbreak. These consequences go beyond our own border as Uganda into the region, indeed globally. These effects are possible to control early if we work together with purpose and under the guidance of the government's one plan. So I urge our partners, I urge all those friends of Africa that let's always work under one plan that is guided by the government so that the results are possible to achieve quickly, as we have seen here. Honorable Ministers, we also take a note of the priority areas that you and your government have enumerated yesterday and partially today that will require support going forward. As Africa CDC and the Africa Union, we commit to continue to support your efforts in ensuring that no other outbreak comes in the way that this one did. Indeed, we are committed to support your government in ensuring that any time an outbreak comes, it is controlled in the shortest time possible. We are particularly pleased that the role of community health workers has not only been amplified, but has confirmed the key part that they play in bringing under control an outbreak of this nature. And we therefore are looking forward to working with the government of Uganda, particularly the Ministry of Health, to continue to support community health work and community engagement and communication. It is our belief that when we look at the experiences we have achieved, the results we have achieved during this particular outbreak, it is our belief that if we strengthen our institutions at country level, if we ensure that our workers, particularly the health workers, are well capacitated and provided with the right tools, if we afford ourselves the opportunity to manufacture our own health products, if we generate the right partnerships, then we can not only be able to do what has happened this time, we can be able to do more. And this is the embodiment of Africa's new public health order, where we are convinced that the continent can be able to take its priorities in its own hands and guide response to any health outbreak and disease threat. Finally, let me remind ourselves that when, in the African saying, that when we come together in the village square, it is not because we cannot be able to see the moon from our homes, and it is not because we cannot be able to have a meal in our homes. Coming together is good for the community. And the way that we have come together to respond to this particular Ebola virus outbreak is the way that we need to continue coming together to build our capacity here in Uganda and in Africa, to build our resilience and our health systems so that any other outbreak does not result in a similar difficult situation for any country on the continent of Africa. Ladies and gentlemen, let us continue to come together for the benefit of public health, for the benefit of our mother continent, Africa. It's a pleasure to be part of this ceremony to declare this particular Ebola outbreak over, and we look forward to continue working with all of you to ensure that no other outbreak takes away from us as much as this one has done, because we have the tools, we have the capacity, and we have the experience to be able to bring it under control very, very fast. It's a good start to 2023, and I'm looking forward to ensuring that the rest of the year is just as good, if not better. I thank you.
So we do appreciate in totality the international community for the good words, but of course also for appreciating Uganda and accepting that Uganda is really doing a good job when it comes to public health emergencies. And we are really looking forward to building more capacity and using our expertise and skills to ensure that our other colleagues on the continent, the capacity is well built. Now that the Director for Africa, CDC, is here, we are looking forward to strengthening that. After the declarations, I think the next step is to receive success stories. And the success stories will be represented by the RDC RDC for Mubende. Before the RDC for Mubende comes, Honorable Minister, allow me to let you know that we have other RDCs here. One for Masaka, of course one for Mubende. I've also been informed that the RDC for Kasanda is here. I don't know where she's seated. But I know the RDC will be able to introduce other RDCs who are here. And she's going to give her remarks on behalf of all the chairpersons of the district task forces, literally who are the RDCs, and on behalf of the district task forces who are here. But in a special way, since we are in Mubende, Honorable Minister, I've not seen the DHT for this district, the DHO. The DHO and his team, they have really done a good job. The DHO and the entire DHT, I don't know whether they are here. I saw Kauma. I suppose that the ADHOs are also here, and the entire district task forces. We appreciate you and your entire team. Madam RDC, kindly come. Since you are representing the president, and the president doesn't take a lot of time, my assumption is that if you use a lot of time, it should be around 10 minutes to fit in the president's footsteps. Thank you, Madam RDC.
Our chief guest today, the Minister of Health, Honorable Dr. Jane Ruth Acheng, the State Minister of Health, Honorable Kawoya, Excellencies present here, the representatives of the UN and diplomatic agencies, the High Commissioners present, the senior government officials, the resident district commissioners, the honorable members of parliament, the district chairpersons, the representative of the IGP is here with us, the health implementing partners, all political leaders, the district chairpersons, the worship, your worship, the mayor, the religious leaders present here and cultural leaders, the members of the media, our beloved health workers and Ebola response teams, ladies and gentlemen, good afternoon, everyone. Biabaseja Rosemary is my name, and I'm the RDC Mubende and the chair of the district task force. But with me are the RDCs from the 9 districts. And since I'm going to speak on their behalf, I'm requesting all the RDCs to come to step forward. Please, step forward, all RDCs. And as they come, allow me to warmly welcome you to this ground on this historical event. Everybody, you're most welcome. And allow me to welcome our beloved sister, Dr. Honorable Acheng. She's a living hero. Honorable, you are now an expert in handling epidemics. Yes, RDCs, please. Can you introduce yourself? Name and district, name and district, name and district.
Good afternoon, everyone. Assalamu alaikum wa rahmatullahi wa barakatuh. Lukanga Amina is my name, RCC Kampala City.
You're most welcome.
Honorable Minister and our beloved important guests around, you are all most welcome. I'm Chibuka Francis Bazigatira Wamoti azigase namwe. I'm the RDC of Mubende working in Mitoma because I'm a born of this district and a resident here, and I work in Mitoma as RDC, but I said I have to join you and to congratulate the people of Mubende for going through that period. Congratulations, my fellow Mubendians. Thank you, my Madam Chairperson. I want to appreciate your effort and your team for the effort you put in to make sure that we are living, we are seen living. Thank you very much. You are most welcome, people from all over the world.
Good afternoon, Honorable Minister and everyone. Lule Senkunge Mtieni, RDC Masaka.
Praise the Lord. Amen. God is good. I'm called Karungi Monica Kanyehe, the RDC of Chege. God bless the Lord for this wonderful day and the great achievement. God bless you.
I'm Seruwaji Faizo, Deputy RDC, Kasanda. Your daughter, she's not with us. She's on sick leave.
Masereka Kisembo Joshua, RDC Bunyangavu.
Honorable Minister, good afternoon. My name is Alari Kamkama Nicholas Kaine, Resident District Commissioner, Kagat District. You're very welcome, lady and gentlemen.
Bilunje Baka is my name. I'm the Deputy RDC Mubende. Thank you so much.
Katibala disengera omusana gye guli omungi badde nsaba muddeyo mutuule ebintu nga bwe bwamuyongambye nja byogera teri kinzija kulekayo. Honorable Minister, allow me to inform you that the district chairpersons were part of the district task force, and with me here is the district chairman Mubende and the chairpersons from the neighboring district. Allow me, Honorable, to call upon them. You should all come. Chairman, come. And Mr. Chairman, we are going to introduce your fellow chairpersons and the executive.
Thank you very much, Madam RDC, the Honorable Minister. My name is Muhereza Michael Ntambi, the district chairperson Mubende, and I'm chairperson. I think the other chairpersons are here. I've been telling you that I'm a chairperson from the NRM party in this Uganda region. I'm among those chairpersons. I want to thank the people of Mubende and to thank the government of Uganda and other partners for this work and the good work done here in Mubende. Surely you've done your work. And Madam Minister, I thank you very much. As they have said, you are a living hero. You know, they were asking me about my leader in the last year. I said, you're my leader. You're one of my favorite leader because you've done your work, both in COVID and now in Ebola. Because at least by the time when we got to know that we have Ebola in Mubende, for us, our hopes were all gone. But when you come on the ground, when you came on the ground, at least we resurrected. And we know that now we have a hero who can fight And I want to thank Madam RDC. Thank you very much. I have my vice here. Let her come. You know, this battle has been for the lady. She's my vice chairperson and the one in charge of health at district level. She has been fighting with the RDC and you fighting the Ebola. So me, I say that this battle has been a lady battle and you've done it. And you have really proved that you know how to do the work. I want to thank you very much. I want to thank my Honorable MP, Honorable Grania Nakazi. We stand up for recognition at least. She has done her work everywhere. But I want to congratulate the people of Mubende that today at least we are going to drink water. At least we have achieved this. And I want to thank His Excellency, President of Uganda, for what and the guidance, the support and everything in fighting this Ebola. He has done it. He has done it. Abagamba ntitasigala kumeini muli kubirala. Fetugamba omusajja akoleki avulumire kolasi weziri obulwadde webuli abulwanyeko kyekirala kyetwagala tetulina birala. We have the here they are chairpersons from these districts. Let them come and introduce themselves. Thank you very much.
Honorable Minister James Ategeka Mugarama, District Chairperson, Bunyangabu.
My name is Karen Besije. I'm the Vice Chairperson, LC5 Mubende District. Thank you for coming, people.
Honorable Minister, Kizito John is my name. LC5 Chairman, Representative, Jinja District. You know very well Jinja District tested Ebola. Thank you.
Honorable Minister, my name is Flavia Nampera. I'm the Vice Chair, Kasanda District, and I'm in for the Chairman LC5, Kasanda, Mr. Kasiri Zimula. Thank you so much for this event.
Honorable Minister, Ndibwami Biosia is my name, District Chairperson, Kagadis Local Government. I want to congratulate everybody present and the country at large. You're most welcome.
Yes, Madam Honorable Minister, my name is Batemia Toluchams Andrew, the chairperson of Masaka District. Allow me to introduce to you these people who worked hard on this issue. First of all is my RDC. My RDC, where are you? Please, can you come here for recognition? This old lady has done a lot, or as far as Ebola was concerned. There is also my health DHO, District DHO, Dr. Faith has also done a lot. Together with the cow of Masaka, Mr. Kawia, where are you? We've been an organized team and we've really done a great job. We've followed the other channels of coronavirus, then into Ebola. That's how we try to ease our work. But thank you very much.
Yes, those are the chairpersons. Honorable Minister, with us are the secretaries for health, LC5, from the 9 districts, the DHOs from the 9 districts, and the mentioned districts as follows. That is Chegegwa, Masaka, Kasanda, Kakumiro, Jinja, Bunyangabu, Kampala, Wakiso, and of course, Mubende, where the epicenter was. Allow me, Honorable Minister, before I proceed with my message, because today we are marking a very, very, very important day. But this success that we achieved as a district or as districts of Mubende and Kasanda was attributed to teamwork. I didn't work alone. I have strong men and women whom I worked with. The district task force of Mubende, please come here. The epicenter was here. That is why the function is here. That team is led by the Deputy RDC. Hurry up, Please come along. RDC, DISO, DPC, DHO, Vice Chairperson you had already seen, and the other leaders. Your Worship, the Mayor. Muje. Where is the DHO? Town clerk. Come. The pillar heads, where are you? The Honorable Minister introduced the pillar heads from the national, but they were grooming and working with our pillar heads, the local pillar heads. Where are you? Deputy RDC, can you come and introduce yourself, please? Come.
Once again, I'm Birunja Beka, and I'm the Deputy RDC Mubende. Thank you so much.
Gahanga Tumusime Vincent Kisanja, Secretary for Education and Sports. I was struggling with schools to be that they are safe.
Bosco Sandikadua, acting DHO Mubende.
DHO. Come.
Honorable Minister, Mtandeka Festo, Town Clerk, Mubende Municipal Council. You're most welcome.
Tumusime Renard, Chief Administrative Officer, Mubende District Local Government.
Time, please.
Honorable Minister, I graduate my names, and I'm the Hub Coordinator, Mubende Region. Thank you.
Once again, Engineer Sechiziv Innocent, Mayor Mubende Municipality.
Kauma Charles, District Health Educator, and I've been the pillar head for risk communication and community engagement. You are welcome.
Bilele Gracias Chibera, District Laboratory Supervisor, Blab Pillar Head.
Sally Edison, Coordination Pillar Head. You're welcome, Honorable Minister.
I am Lieutenant Ronald, Head of Natural Resources. I was coordinating ecological survey.
Namsoke Mary, I was coordinating IPC WASH.
Kasumba Hakim, Surveillance Pillar Head.
Bwiwa Ivan, Head of Psychosocial Support Team.
Dr. Emmanuel Batiwe, the Director of Regional Referral Hospital Mubende.
Honorable Minister, allow me to introduce the representative of the IGP, because this outbreak came along with the lockdown. But the people who led and implemented the lockdown, he's come, step forward. This one is representing. And you come and mention your names, we need to know you. I also have the local district security committee, DPC.
Honorable Minister, I'm Assistant Commissioner of Police, Onen Chan Stephen, the RPC Wamala region, this region, but today I'm representing the IGP in this function. Thank you.
So, Honorable Minister, we have the DPCs from the entire region who commanded this. Let me go now to my message. It's my great pleasure to be here on this 11th day of January 2023 as the World Health Organization declares Uganda free and the Ministry of Health. It's now 42 days after the last confirmed case was discharged from the Ebola treatment unit. It has been a great combined effort to get there. The Ebola outbreak was announced on September 20th here in Mubende. And this announcement came with a lot of selfless acts that have made this day possible. Honorable Minister, on behalf of my fellow RDCs and the Ebola District Task Force members, I would like to thank His Excellency the President for his wise counsel and leadership, working with the Ministry of Health in ending Ebola outbreak. We are proud of our dear President's wise leadership in our times of need. His well-calculated measures and warranted a lockdown in Mubende and Kasanda, which greatly support the end of movement cases from this district. This preventive measure further slowed down the infections, and it was a key reason that helped end of Ebola outbreak in Uganda. Within only 10 weeks, we had already knocked down the virus. I think internationally, Mubende is on record to end Ebola within only 10 weeks. We greatly thank His Excellency the President. We want to thank you, Honorable Minister, allow me to thank you in a special way for coordinating on behalf of government all the implementing partners and the donors who came here and camped here, which has made a great, great, great contribution in the end of Ebola. In this district, or the two districts, even others, we had all the officials from the Ministry of Health, directed by you, Honorable. We had members of the World Health Organization, UNICEF, World Food Program, UNDP, IOM, USAID, UKAID, Africa CDC, and other donors. We also had local implementing partners like Red Cross, MildMed mentioned. The international partners for the strong commitment. We want to thank the international partners for the strong commitment working together towards ending the deadly Ebola virus. In the same faith, I also wish to applaud the selfless actions of our dear health workers, community mobilizers, and individuals on the front line. Thank you for the job well done. I also want to thank our task forces at all levels and in all districts. I want to thank you for great work that has been done to achieve this success. To the communities that we serve, I want to thank you for taking initiative to adhere to the ministry SOPs. If the communities had not adhered, I don't think we would succeed. Not only the SOPs, but also to adhere to the presidential directives for the lockdown. I also want to commend you for being part of this fight against Ebola. Thank you for the alerts you sent to us on suspected Ebola cases. And I want to believe that we as a community, we have taken our lessons. Honorable Minister, allow me to tell these people that let science always play its role. Because I remember when I discharged the very last patients, survivors, they were expecting the lockdown also to end the following day. Yet there are certain scientific things that were supposed to be followed. So I'm appealing to the communities, let science always play its role. For all those who lost their loved ones, we mourn with you. And pray that God Almighty continues to comfort you. To the Ebola survivors, we thank God for saving your lives. The communities where the survivors came from, please do not harass these people. Do not discriminate them. They are healed from Ebola like any other curable disease, like malaria, and you should continue associating with them as before. Please support them in every possible way. Lastly, I want to thank the people of Mubende and Kasanda districts for understanding the need for the lockdown. Your cooperation played a very critical part in ending this Ebola outbreak. In also a special way, I want to thank the security team that implemented the lockdown that implemented the lockdown, it was a very big contribution. I also want to appreciate the Honorable Minister for Health, Honorable Dr. Jane Ruth Acheng, and all the health care workers for the sacrifice. The Honorable Minister used to come here every week, should be here, and each time she would come, very new things. It would be a turning point for everything. I request that you once again clap for her. And not only that, she would come with her PS. She would come with the entire team, whereby each of them would answer any question that would come along. I want to thank you, the Minister of Health, and her leadership. I was thanking you for the sacrifice, tireless efforts, dedication, and commitment to end the Ebola outbreak and ensure that Uganda is free from Ebola. Banange mwebale nnyo, mwebalire ddala. I thank you for your selfless service, and may God bless you. I've said this for God and my country. Banange bana Mubende mukulike, ne bana Kasanda, ne bana Uganda mwenna. Mubende fe tusoose mu nsi yonna okulwana ekirwadde ky'Ebola mu wiiki 10 zokka. Naye nga maanyi gammwe. Banange President waffe yakola omulimu munene olw'omuggalo. Ne bwe kino abantu abalala balowooza nti it was a punishment. Naye njagala bategeeza we baayogerera omuggalo. Obulwadde nga buli bunyanga bwe waffe gyenva, nze nva bunyanga ne kyamaani wange mumulabye. Naye nga buva wano. Omulwadde yasooka e Kasanda nga yava wano nga butandise okutambula. N'olwekyo lockdown eno yatuyambako nnyo. Olw'ebyo ebitabo ebirungi tubasaba mutusonyiwe naye kino kye twali twagala nti ekirwadde kiggweewo tuddemu tweyagale. Era President mukubire mu ngalo. Minisita waffe abadde abeera naffe, ba health workers basulanga nga tebeebase. Njagala kwebaza ttiimu zino. Abantu baffe abakoze omulimu. Ba hygienists abadde mu malwaliro omulimu gwe mukaze, Mukama akibabalire. Ba health workers, ne ba health workers, namwe Katonda akibabalire. Security team, village health teams. The issue of contracts and whatever. Me, I left this office at night. We have handled this thing, we have discussed it. Ate we chituse, twabayogedde namwe eggulo we chituse ekintu kiwedde. But most people have been paid, only that they have not got 100%. And that one, I know our technical people assured us they are going to handle. Naye n'ebigambo ekyo ekikulu mwakola omulimu mulungi twebaze Katonda twawona atajja kibalira kibaweeremu omukisa. Ebyo mbyogedde olwa Katonda n'ensi yange. Ssaabasajja wangaale.
Madamu RDC omazeeko ebigambo byange nabyo byogedde. Weebale nnyo weebalire ddala. Katwebaze RDC olw'okukiikirira obulungi task forces ez'enjawulo ate n'abasawo ab'enjawulo okuva mu district ez'enjawulo. Tukwebaza maama RDC olw'omulimu gw'okoze mu response. Ate tukwebaza bwe watonda kujja wano twali tutunaba kulaba kire kyankuba. Bwe watuuse wano kire ne kikyuka. Olabika ndowooza olabika olimu emikisa. Honorable Minister, in a special way, allow me to introduce the following people. I know the US protocols may not allow, but since I work with the government of Uganda, I may be able to introduce the following without endangering the protocol of US government. We have the USAID Director, Mr. Richard Nelson. We also have Dr. Alisa, who has been represented by, no, not Dr. Alisa, my apologies. US CDC has been represented by our colleague whom we have worked with since the COVID-19 outbreak and now Ebola. And I know that the ambassador will be able to speak more to the entire team that has come. We have Associate Professor Bruce, who is currently the PI for the current research that is ongoing. Dr. Bruce, you're welcome. We also have Dr. Mr. Chuayengela, the chair of the Scientific Advisory Committee. I don't know if we have other members of SAC. I don't know whether Dr. Ami sits on SAC or not. She does. So the entire SAC committee is here. Ami is here. I think Dr. Bruce is here. The PS is here, and many more others. We also have two other regional referral hospital directors. The regional referral hospital director for Naguru, Dr. Tugaineo, is here. We also have Dr. Alfred Yai, the regional referral hospital director for Jinja. Colleagues, you're most welcome. Honorable Minister, allow me at this time invite the accounting officer for the Minister of Health, who is Dr. Diana Atwine, to come and address us. Dr. Diana, you're most welcome.
Before I make my remarks, I request that we stand and observe the moment of silence for our colleagues that passed on and the families that suffered because of Ebola. May their souls rest in peace. Please sit down. Allow me, in the interest of time, to observe the protocol since we had been all introduced. Honorable Minister and Honorable Minister of State, the members of diplomatic corps, the UN family, the other development partners and implementing partners, our senior officials, the members of parliament, I think one of the member of parliament is here, the local leaders that have been introduced, the gallant men in uniform. I have not seen the representation of UPDF here. Maybe we shall take Chove, but we want to appreciate in a special way because these are people who do a lot in the behind scene and they are never appreciated. Today I want to take this opportunity to appreciate the role of UPDF and all uniformed men in the support and the resilience they have always shown whenever we get an outbreak in this country. We thank you so much, even those that are not here. We want to take this opportunity to appreciate them. Our health workers have been appreciated. The survivors, we congratulate and we thank God. We know that it was not by power, not by might, but it was the grace of God and the support of the health workers and everyone. So we give God all the glory for yet another chance that God gave you. And you need to ask yourself, why you? And I think that is a question that if you are here, just ask yourself, and you do a little more because there is a purpose why you are alive. I'm here to add my voice to those that have already expressed the gratitude. The development partners, the implementing partners that came in and mobilized resources very fast to implement the government effort to make sure that we're able to deal with this epidemic. On 20th, when we declared this epidemic, on 20th, when we declared this epidemic, we assured the public and international community that Uganda has built a resilient system that is able to deal with any epidemic threat in the country. And we assured you that we had the capacity and we are going to handle. And in 10 weeks, in good record, Ebola that we had missed 2 weeks, and it penetrated into the community. I think this is the first time when we got this epidemic, when it had been in the community for quite some time. But we're able to deal with this threat and bring to a halt. We want to thank you so much, all of you once again. I want to resound the points the director from Africa CDC mentions, like he was in my head. We are here to celebrate the milestones that we have attained as a country to contain the epidemic. But we know that we are in the belt, that our Uganda and Congo and Sudan are in the belt of the areas that are prone to epidemics. And as you heard clearly when the minister was taking us through the history of Ebola, we have had several outbreaks. But what we know that every time we get epidemics, we get some lessons learned. And we build on the experience even to do more and to do it better the following time. In 2000, when we got the first Ebola outbreak here, the samples were shipped to Atlanta. And that's where we're able to do the diagnosis of Ebola. I want to celebrate the milestone of Uganda, that we shall continue to engineer and pioneer. We shall continue to pioneer solutions. In 2022, we're able to demonstrate to the whole world that you can handle the most dangerous pathogen in a mobile lab. Thank you so much, our gallant men in the service, especially in the laboratory. There was so much skepticism that people are going to die because but we knew and we trusted our systems. We knew that we had built resilience. We knew that we needed to get out of our comfort zone of the norm, only taking to one lab in Entebbe, losing time, and we took a step of faith because we trusted our systems, we trusted our workers, we trusted our technical capacity in the laboratory services, which we take pride that we have rebuilt together with our partners. We thank you so much that in 2022, we had a mobile lab here that was able to handle the most dangerous pathogens, and nobody got infected in a laboratory. We thank you so much, and we continue to build that capacity so that we see this rolled out in entire country.